Now, public health emergencies such as what we have at hand, COVID-19, are stressful times for people and communities. Fear and anxiety about a disease can lead to social people stigmatizing others. So how do we fight the virus and not the people? Dr. Amachewa Edwin is a physician, clinical psychologist, and senior lecturer and head of Department of Psychological Medicine and Mental Health, School of Medicine, University of Health and Allied Science in Ghana. Good morning to you, ma'am. I must say that it was very refreshing listening to you last Tuesday.
Thank you, but I must correct the designation.
Okay.
I'm on a leave of absence from you. So I'm a physician, clinical psychologist, and bioethicist, currently working at UGMC. So I am not head of department,
okay,
and I am not with you at the moment. I need to put that on record, please.
Okay,
this
great.
is important.
All right, I like
that. You didn't ask me for where.
No.
Yeah, so please correct that. I know why I'm emphasizing that. Please.
Absolutely,
it's important,
and that's on record. So great. But let's get into the conversation of stigma. What forms can stigma take?
So stigma, two main types. We have the social stigma where others are stigmatizing you, and then we have the self-stigma where an individual internalizes what societal what members of the society or community are stigmatizing. So let's say in this era of COVID-19 pandemic, we know that there is stigma affecting those who have the disease, those who are even thought that they could have the disease, or those who are being investigated for disease. Then their families, and then health workers. Any of these groups can internalize the stigma in the society, and then it becomes self-stigmatizing. The importance of that is that when you self-stigmatize, you tend to see things through a clouded lens. Typically, we have that with people who have mental health challenges. So someone will say, oh, we do about that one, papa, no, that kind of thing. And then you begin to question your own sanity when you are doing things. Anytime you think that you are having a relapse of a condition, you are fighting with what will people say, will it affect my job, will it affect my relationship? It's already in the society, but you have internalized it and you live your life with that. And it's important in this era that the stigma out there is one thing, but for those who are affected by COVID-19, whether as patients, whether as family members, whether as health workers, need to look out for that. So those are the two main types of stigma, the social stigma and the self-stigma or perceived stigma.
Okay. I want us to also talk about the fact that there are people calling for persons who have recovered from COVID-19 to assist in educating the public against stigma. What's your take on that?
Great. In fact, this morning I was talking to someone I know who's been through that, and I said, you have a powerful voice. I can talk a lot about stigma, but you have a lived experience, especially when you work in the health sector or you are frontline. So these are people we need. We have something that we call making heroes' voices heard. They have been through something most of us haven't been through and probably won't be through. So when they talk about the disease, when they talk about the fact that, yes, you can have this disease, yes, it can be challenging, but yes, you can overcome it, yes, you can come out on the other side, it's a powerful testimony. And I, for one, am championing this. So as many people that as I'm providing psychosocial support to, or I know, I talk to them that please, we need people like you to share your story, to tell your narratives, and to emphasize the importance of staying at home. My particular target is the health workers who have been affected by it because they were doing their regular kind of job. For those of us who work in a treatment facility, when I'm going to the facility, I know that where I'm going, we are treating people with COVID-19, and so I will wear the appropriate PPE, whether it's just a surgical mask or N95, or I don the full gear, depending on what I'm doing. But the clinician who is running his OPD, the surgeon who is operating on a patient, the person who's seeing patients on the ward, some of them have been affected, doctors and nurses who have been affected by the disease. They have experienced stigma. Unfortunately, sometimes even within the health profession. And that's very sad. Some of them have literally been thrown out of their homes and their communities. But if we can tell these people to share their narrative, that would be a powerful thing. So if that is something you are doing, I'm on board. It's a very powerful group we have. We need to harness that. We need to honor them. We need to celebrate them. And they can be real advocates and activists for this fight.
But from your conversations with them, are they willing to get on camera and share?
Oh, yes.
Okay.
Oh, yes. Yes.
All right.
The few I have spoken to, I don't know whether it is me, and I kept telling them, don't feel bullied because I am asking. It is your story.
Yeah.
And it's like, oh, no, we are willing. We have a story to tell. So the few I have spoken to are willing to do it. It's the form
so
that
maybe
we have
after this conversation, we can arrange and get some of them to share their stories with us. We're open to doing that. That would be really, really good. So
okay,
but I just wanted to also ask you on the back of that, I mean, what's the difference? We've seen some very popular people outside of Ghana openly say they have it. Like why can't we do the same?
Exactly. So generally, let's look at our population. What's the percentage of our population who are educated, who can read whatever they see in the media or on social media and interrogate and not buy into it? That's one thing. And then we also have a low level of health literacy. So you even have educated people who come to hospital, they've been diagnosed with maybe hypertension, diabetes, or some other condition. You ask them their medication and they don't know their names. Sometimes it's from us, the health workers. We don't take time to educate them. Sometimes it is also from them. It's both. So that is health is a problem. So this is a disease that is unknown, that is evolving. We tend to either spiritualize or attribute supernatural things to everything. So misinformation thrives. We have an infodemic that is also undermining even the real information. And sometimes when you even try to educate people, I'm on some social WhatsApp group and other networks, that there are certain things when I see, I can't keep quiet. But then you come at it and it's like, oh, you don't know. You're only limited to your medicine and you think everything is out, is what is happening. So people are not even willing to engage in that. In such an environment, misinformation will thrive. So if I come and tell you that it's because of A, B, C, and D, then with my understanding of why we have the COVID-19, I will see you as an adult. I'll see you as you have brought the disease and we need to get rid of you. Either we get you out of the community or even the home, or even those who are working in it tend to stigmatize. So it is our culture. This is not the first time we are having that. The same thing happened with HIV. Before HIV, mental health has always been an area where it's been stigmatized. You work in mental health and people saying that, oh, you know, and so it boxes you and that challenges that. So we have an environment that makes stigma thrive. But we also need to look at the fact that this thing we are fighting is not a Guinean thing. It affects all of us. And so if we don't come on board and decide to fight it together, you might think that you are safe. You might think that you have not traveled. You might think that it will never happen to you. But you never know, because now we have community spread. And that is why we all need to come on board and make sure that we fight this. Because when we don't and we stigmatize people, they will hide their illness. They will hide their symptoms. They will not even come to the hospital. If they are coughing, either they will try and hold on to the cough when they are in public, or they will sneeze quietly, but people will go underground. And when they go underground, they will not keep to social distancing, and that will spread. And it's because of stigma. But if we embrace this fight together, that the fact that you have it is not your fault, it doesn't make you an outsider, that you are not responsible for bringing the disease, but you traveled, or you were doing your regular work, or you were getting on with your life, or as we say in Ghana, you were sitting or somewhere and you got the disease, you are able to talk about it and share your story.
Okay.
People are willing to talk, but they also weigh the option. Will I get more stigmatization when I come out? Okay. These are some of the things we are looking at now.
All right. Doc, finally, I want us to talk about mental and physical health. Usually we ask that in relation to a person with the disease. But how about the rest of us, people who are staying at home? We're asking people to stay at home unless you're an essential worker. I come to work every day, and I'm thinking about my family. Would I go back home with the disease? God forbid. But if it happens, it means that I'm spreading it along as well. There is a psychological, mental issue that we all have to look at. Point us to the right direction. How do we get over all these things that we're thinking about?
That is true. And as a health worker, I can identify with that because I'm cognizant of the fact that I may get the disease by virtue of my work or even aside that. So how do we deal with it? A few things. The right information is important. What is the disease pattern? Yes, it's a disease that is still evolving, but we know that majority of people who get it will get mild disease or even asymptomatic, up to 80%. So it means that 80 out of 100 people who get it will have the mild form of disease. Some of them may never even have symptoms. They won't even know. Then we have up to about 15% who may have moderate disease, and about 5% will have severe disease and usually with comorbidity. So just having that means that the odds are in your favor, all things being equal, that if you get it, you will get the mild disease. Even if you fall into the group that gets the moderate or severe, the outcomes are still much, much better than Ebola and many other diseases that are fighting us. So looking at the worst case scenario and realizing that, okay, even if the worst happens, it's not the end of the road, it's not the end of it for me, should give you some confidence. Then you also know that you cannot walk in fear. You cannot live in fear. Several people have talked about the fact that do not be afraid or fear not. You have it up to 365 times in the Bible, meaning that every day God is telling us, don't be afraid, because the natural inclination for us as human beings when we see a threat is to be afraid. But then when we become afraid, we become paralyzed. We are more likely to make mistakes when we are afraid. You see that when you are stressed, you're more likely to make mistakes. You are driving and you are absent-minded. Either someone hits you or you hit someone, or you can get an accident. You are in the kitchen and before you know, you've cut yourself. You are doing something, and all these things because you are heightened. But you need to calm down. You need to take stock of what is going on in your life. What are the stakes in your life? What are the things that make you stand? If all falls down, what can you count on? For a lot of us, it's our belief system, it's our faith, whether we are Christians or whether we are Muslims or whatever our belief. So these are the times to hold on to the tenets of your faith. It helps. If you have a community where you share, where you encourage each other, let each other know that we can beat this. People have done it, people are doing it, and we have the ability to do it. Yes, staying at home is not easy, and those of us in the front line, it's not easy either, but we cannot let fear paralyze us. We need to take care of ourselves. We need to eat well. We need to rest well. I know that it's not easy. I was telling someone that I don't remember the last time I had more than 5 hours. If I get 5 hours, it's like, thank God. Because there's so much, even when you are not physically at work, there's still a lot of work you need to do in regard to this. And it's the same for you in the media. But if we also break down, we'll be of no use to anybody. an empty cistern cannot hold water or give water. So it is imperative that those of us in the front line, whether we are in the military, whether we are in the police, whether we are in media, whether we are contact tracers, whether we are in the front line in hospitals, facilities, wherever we find ourselves, self-care matters. It is important.
Okay.
We need to sleep well, eat well, exercise, at least keep fit, walk around. Don't just be physically inactive. By virtue of what we do, most of us tend to work. So we need to do that. But we need to have a positive mindset that we can overcome it, that you don't expect to get it. But even if the worst happens and you get it, it's not the end of the world for you. It doesn't mean you're going to die. It doesn't mean you're going to get severe disease. And that is why we need the narratives of those who have overcome it to share their stories and to give us hope, to let us know that they have walked this path and they overcame. And if we also get it, we can overcome. But majority of us won't get it. So we need to have that positive attitude.
Amen to that, Doc. Thank you very much. Amen. I think I should be talking to you more often. And I want to take the opportunity to also celebrate you and your work as well. Thank you so much for talking to us.
You are most welcome. Have a good day.
You too, Mom. And that's Dr. Amma Edwin there. Let me just end by saying, if you don't already, you will soon know someone who has been ill with COVID-19 and survived. They will be our friends, our family, our neighbors, and our colleagues. History will judge us by the way we treat them. Don't let fear of COVID-19 turn into stigma. I hope we all got that message.